Well, it's time for a health report, and joining us now is Africa 54 health correspondent Linord Moudou with a look at the emerging Zika virus. Linord.
The head of the World Health Organization says the flu-like disease caused by the mosquito-borne Zika virus could spread even further in the Americas. The tropical virus is blamed for causing severe birth defects, and some governments are warning women not to get pregnant for the next 2 years. VOA's Mariama Diallo has more.
A laboratory in Rio de Janeiro is offering quick tests to detect the Zika virus, which can possibly cause microcephaly, leading to abnormally small heads in infants. Brazil has been the hardest hit by microcephaly birth defects. The World Health Organization has now seen close to 4,000 cases, more than 30 times higher than in any year since 2010.
Uma situação muito alarmante.
The situation is very alarming. It's an emergency situation, not only for Brazil, but all the countries affected by globalization and also by the climate and increasing temperatures.
Blood testing alone cannot predict the Zika virus. The Sangue-Bom lab uses a combination of patient symptoms and blood testing to make a diagnosis.
Uma população que
We already have a generation of people hit by microcephaly who will have to live all their life with problems induced by microcephaly, which means slowness in mental and physical development.
Daniela Alves de Jesus is 21 and has recently been infected by Zika. She came back to the Sangue laboratory for a follow-up.
I couldn't even get up. I couldn't eat without help. My brother helped me eat. I couldn't even grab the fork with my fingers. It would hurt, and I ate slowly.
Zika infection.
WHO Director General Margaret Chan says the disease and the virus might spread to all countries in the Americas, except for Canada and Chile.
The explosive spread of Zika virus to new geographical areas with little population immunity is another cause for concern, especially given the possible link between infection during pregnancy and babies born with small heads.
As some countries warn women not to get pregnant in the next 2 years, Chan emphasized that no causal link between Zika and microcephaly has yet been definitely proven. Mariama Diallo, VOA News.
The WHO says the Zika virus may infect 3 to 4 million people in the Americas, including 1.5 million in Brazil. Now joining us live via Skype from the WHO headquarters in Geneva, Switzerland, is Dr. Bruce Aylward. He's Assistant Director of the WHO. Welcome to the show, Dr. Aylward.
Good afternoon.
So first of all, we heard that the virus was discovered in 1947, but what took so long? Why are we raising the alarm now, and how deadly is this virus?
Well, we've known this virus for a long time, like you say, but during most of the 50, 60 years we've known this virus, it's been a virus responsible for a relatively mild disease and without any long-term consequences that people were aware of. What's concerning now is in Brazil, where this virus hit pretty hard earlier this year, there has subsequently been as you mentioned, your reporter mentioned, a lot of children born with small heads, or what we call microcephaly. And the question now is really, are these things related? And until we can answer that question, what precautions should be put in place, and what advice to women who are seeking to get pregnant? So that's really the reason for the concern right now, is really the problem of all these babies born with small heads in one part of Brazil, and trying to understand, is this due to the virus? We know it's associated in time and space. The question is it a causal relationship? It's going to take some time to answer that question, but women need advice today.
So it's going to take some time, as you mentioned, but how realistic is it to tell women not to get pregnant? And what other ways of prevention can be enforced?
Well, I think that's exactly the point. We need to remember that for women who do get pregnant, and women are going to make decisions about when they get pregnant based on many factors. And when they do make that decision, a key thing, just good public health, is not to get bitten by mosquitoes, and even when you're not pregnant, because they can carry other viruses, dengue, chikungunya, etc. So really, it's about really reinforcing those measures that we will know will reduce the population of mosquitoes by eliminating stagnant water areas, etc., and then taking precautions to reduce the risk of you getting bitten by mosquitoes in terms of the kind of clothes you wear, the use of appropriate sprays, sleeping on bed nets, all of those things that will help reduce your exposure are going to help.
So there are no cure, according to the report we heard. What are the WHO's recommendations in terms of addressing this disease?
Well, we've got recommendations at the level of the countries as well at the level of communities and obviously for individuals. I just talked about some of those recommendations for individuals and especially for women who may be pregnant or getting pregnant, certainly until the issue of causation here is an association is sorted out. So at the national level, though, what's so important is making sure there's surveillance for Zika virus, making sure there's surveillance for the kind of neurological complications that people are worried about and we're looking to understand better. Also to do the necessary research when they are happening to try and understand what's going on. There are also recommendations for how to control the population of mosquitoes to reduce that. So there are many, many things that can be done to understand the spread of the disease to reduce those risks.
Okay, Dr. Aylward, thank you so much for joining us today.
My pleasure.
And that was Dr. Bruce Aylward. He is the Assistant Director of the World Health Organization. That's our Africa Health Report for today. Vincent?
Well, Linord, thank you very much. And be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54. Well, we want to know what you think about Africa 54 and the stories we covered. Join the conversation on Facebook. The address is Africa 54. And check out our headlines 24/7 on voaafrica.com. Find me on Twitter at VOA Vince McCory. Well,